A prednisone warrior asks, Hi, yes, I've been reading information and blogs. I am holding on 13 milligrams of prednisone and 15 milligrams of meloxicam. The rheumatologist wants me to try Kevzara. Any insight to this drug? I have polymyalgia rheumatica. Thanks, Marge. So I'm Dr. Megan, the prednisone pharmacist, and based on the very little information that is shared here, I have to make this disclaimer that this is not medical advice. Go to your doctor for clear information, but based on the little amount I can share, polymyalgia rheumatica is a really tricky condition that usually prednisone is the best treatment for. And so if you're really struggling with prednisone and the side effects are intolerable to you, then maybe consider an alternative. But that's really between you and your doctor. So, what are the alternatives you could try? Well, Kevzara was recently approved by the FDA, and that is great news because before a couple years ago, there were no alternatives to prednisone. So, this is great progress. However, it's not like a slam dunk, it's not perfect. Let me just read you the results of the studies. So, Kevzara's generic chemical name is sarilumab, and it was approved by the FDA if you cannot tolerate the glucocorticoid taper, the prednisone taper. And they did a randomized trial, and they had 118 patients who had relapsing PMR. And those who were assigned to take sarilumab or Kevzara every 2 weeks had a higher rate of sustained remission than patients assigned to placebo. But it was only 28% versus 10% on prednisone. So, like, it wasn't 100% versus 10%, it was 28%. Now, that's more like that's almost 3 times as many people who had a sustained remission than who took prednisone, but it's still not that good, right? And then the other new alternative is called tocilizumab, and its brand name is Actemra. And it showed that it was 63% of the people had steroid-free remission versus 12%. So we're looking at 10 to 12% of people are in general able to get off prednisone and stay in remission from the PMR. And either sarilumab or tocilizumab can get you above that. But they're not 100%. So it sounds like potentially the Actemra works better than the Kevzara, but they haven't compared them to each other. So we don't actually know that. So maybe, maybe not. If your insurance covers it at a reasonable amount of money and you're really, really struggling on prednisone, it's a great alternative. Is it, a perfect treatment? No. So those are my thoughts on these potential alternative prescription medications for prednisone. Others also include methotrexate and rituximab. Others haven't been shown helpful. So hope that helps. Signing off as Dr. Megan, your prednisone pharmacist.